Hi everybody, this is Jess Eldridge from Sweaty Ganesh Yoga, and I'm here to do a follow-up video for the first hyperextension video on why hyperextension and Lock-the-Knee are problematic in yoga. So today I have some students and some teachers here to help me demonstrate different body types, including different capacities for hyperextension, and then how to work with this in a Bikram yoga class or a Core 26 class. Of course, these are ideas that would apply to any yoga class that you would take. I'm going to focus specifically on the Bikram class because this is really not information that we're taught in Bikram yoga training. I think it's pretty important. So today, in addition to looking at the specific hyperextension of the knee joints, we're also going to look at the arches of the feet and the positioning of the pelvis, because all three of these things have a role in maintaining and creating a really solid foundation for yoga postures. So the way the Bikram series is designed, you're actually given a tremendous amount of information about your students' joint structures and their foundational stability from the very start of class. So let's start right here with the foundation for pranayama breathing and the way your students set up at the beginning. So we'll start here with Julie. So before Julie even sets up for pranayama, just as she's standing normally, I'm noticing that she does not have the capacity for hyperextension. So we look at the way that she stands here, and I'm just focusing on the lower body right now. Her hips are actually stacked above her ankles right here, and her femur bone is stacked on top of her tibia. So there's nothing strange or out of alignment here. In fact, if I were to ask her to jam the knee back all the way, though I should do that, we would see she actually doesn't have the capacity to move the knee back behind the hip bone or the ankle bone. So if we look at Jocelyn, she has quite a different body structure than Julie. So if we look at Jocelyn again, even before she sets up for pranayama, just standing normally here and fully relaxed, you'll notice that, okay, we've got a hip bone stacked over the ankle bone here. Her knee is in fact behind both the hip joint and the ankle joint, showing the capacity for hyperextension. If we were to examine where might her femur bone be, I'd look at this line, about right through here. Where is her tibia bone? It's going to be at an angle. So you'll notice that the bones are actually not stacked one on top of the other in a vertical line. They're actually more at an angle, which again shows the capacity for hyperextension. Now she knows how to work with this in class. So if she were to set up for pranayama, her leg would go from this position to the position she'll go to right now. So the leg is slightly bent. It's actually not bent. What it's doing is putting the bones in alignment. But based on her capacity, there is a slight change. So again, just show them both relaxed. Here it is back behind here, showing hyperextension. And then here's where she would set it up for pranayama, where it moves just slightly forward. And again, this creates much more foundational stability through her body. She now has a conversation happening between the foot and the hip joint as well, bringing on board the pelvic floor and the lower body. So if we turn to Dorothea here, she also has a different body structure than both Jocelyn and Julie. She also has a looser joint structure with the capacity for hyperextension, but we see even more significant things happening here. So if I were again to look at her lower body, what we see is that her hip joint is actually in front of her ankle joint. She's pitched forward through the lower body here. And her knee joint is actually back a little bit, so that if we were to put the hips in alignment, the knee would again be behind both the hip joint and the ankle joints. So she has something else happening here in addition to the capacity for hyperextension going on in the pelvis, which we'll talk about in just a second. Important maybe to know also that Dorothea has had problems with her hamstrings and pulling hamstring attachments and the hamstrings because they are already in this overstretched position. If she were then to weight bear on this leg in a balancing pose without putting the knee into proper alignment and putting a micro bend in it, this is just going to overstretch these hamstrings further and potentially create injuries, which it has for her in the past. So to complicate things just a little bit more, when people have the capacity for hyperextension, what it often does is put the pelvis in an anterior tilt, which means that the front hip bones tip forward, the back hip bones tip up, so that you put the lower back in a compromised position. That's something that we can notice, and especially in Dorothea here. She is pitched forward again, this way if we ask her to stand naturally. Yep, go ahead, go from there, and then go ahead again, just to back like this. So you're actually watching how the pelvis now tips forward and your lower back is in a compromised position right here. So Jocelyn has the same capacity. So if we look at her, if she stands here relaxed with her legs back in this anatomically locked position where they hyperextend, we also notice that her pelvis is a little bit of an anterior tilt, and again, she has an accentuated lumbar curve, which means that this is a compromised area in her back right now. So one more piece of the story is what's happened to the arches of the feet. So if we look first at Jocelyn here, and we observe what's going on with her feet. I'm observing that the inner arches of both of her feet are collapsed, and it looks like the left one is collapsed a little bit more than the right one. So to correct this problem, it's what we talked about in the first video for her, and again, this goes hand in hand with hyperextension. So to make this different, we needed to put a slight bend in both of her knees so that we stack the joints. We're going to remove her knees outward just a touch toward the pinky toe, which lifts the inside arches of her feet. This again creates much more stability and lights up that conversation between her feet, her outer hips, and her pelvic floor. So just to wrap up this first piece, the essential idea is that you are given a lot of information about your students in the first, I would say, 8 minutes of class. So pay particular attention to them in pranayama breathing, the way that they stand, the way that they move. If you've got a student who's wobbling back and forth on their base as they're trying to breathe, you're given that information about what is the joint structure doing, how much stability can they create, and what areas of their body are they working with that they want to not keep compromised. So looking again at the arch of the feet, that capacity for the knee jamming back beyond the hip bone and the ankle bone, and what is the pelvis doing? Get the pelvis in the trunk place. Next time we'll focus on each posture in that Bikram series and how to work with it in terms of your students who have that capacity for hyperextension, also those who have the capacity to collapse their inner arches, and those who tend to anteriorly tilt the pelvis, putting the low back in that compromised position. So we'll go through one at a time and take a look at really how to work with that in the classroom.